However, we did find that patients with sporadic disease were more likely to have distant metastases during their course, as seen by a hazard ratio of 6.7, as compared to patients with hereditary MTC. Now, this might seem a little bit odd, as we usually feel the hereditary MTC to be more aggressive. And in our group, the hereditary MTC patients did have more bilateral as well as multifocal disease. But again, we think some of these favorable outcomes could be because these patients were diagnosed as well as underwent surgery at a younger age. So a surgery at a mean age of 36 to 38 years, as compared to surgery in sporadic MTC patients that was at a mean age of 56 years. Most of these patients were diagnosed by family screening, so were diagnosed at an earlier and a lower disease stage. Most of them did have moderate risk RET mutation, and 85% were diagnosed with stage 1 or stage 2 disease at the time of their presentation, as compared to 36% of patients with sporadic MTC that had stage 1 or stage 2 disease. We also found that patients with hereditary MTC were less likely to have a elevated calcitonin after their thyroid surgery as compared to sporadic MTC. So we feel that these factors likely led to the favorable outcomes in hereditary MTC, especially in our cohort.